Again, this is a very large area treating. I'm going to do 3 in this area too. So treating pretty quickly, getting to temperature. And especially in the abdomen, the motion absolutely is comfortable where there's fatty tissue. Usually, you've got some degree of cushion and you're not right over bone. You're not going to have much discomfort from this. Certainly no need for numbing and no need for cooling. Now you can see where some of these areas are still actually getting pinker after we've moved off of them. So you can see where there's some reds. I'll just smooth out my gel a little bit. These are the hot spots that are coming up, and we're really just going to go to the point where we get that nice absorption of the energy as evenly as possible over the treatment area. We're getting a little bit, as it accumulates, redness in the general, so I'm going to start overlapping areas a little bit. And usually around on the tummy, I try to work kind of over the umbilicus, just kind of occasionally, because that does tend to be an area that the skin is thin and they can get a little bit warm there. So we'll just now mix it up. We've been all over the 4 areas. So we're going to do a little bit more just in the center. And sometimes if you feel like an area, you can slow down a little bit. How are you doing there, Christine? Is it comfortable? Yeah. Not feeling any kind of
no, it's just a little
burn?
That's it.
Okay. Most of the time, patients really feel like this is like a hot rock massage. It's just really comfortable. They can fall asleep on the table. They're not worried about you doing anything that's going to make them jump off. And so we're getting to a nice, so I'm going to just smooth that out a little bit so we can see a little better. You can see how we're getting a little pink here, and we're just going to work in this area. And sometimes I will work on a continuous where I'll just kind of keep working around. You're kind of moving the pulse slowly as you're covering the area. There's no real rules as long as you do kind of keep that motion concentrated enough in one spot that you're seeing the energy build. So we're starting to get a little bit more even redness. And if I wanted to take my temperature probe now, I would bet that I'm going to be seeing that at about 39 degrees where it's nice and pink. Sometimes in the abdomen, because there is fat that can store some of that energy even deeper than we're trying to treat, it'll radiate back up and you'll see the pinkness actually get more, even though the patient's fine because she's not feeling anything on the surface. The surface is not feeling hot, so she's not uncomfortable. Is that still comfortable?
Yeah.
Yeah. So you can sometimes, and you do want to kind of move off if an area is really getting red, because sometimes they will have no discomfort and you are definitely to temperature. So that's kind of how you blend your areas, and you just kind of keep it moving. And you can get a lot of energy down. We're putting 100, 150. I went a little too fast there. We're at 28 pulses, 150 joules per pulse is really. So you can see the nice, I'm going to do a few more right around the tummy button and we'll be almost done. I like to feel like I've had at least, at 11 seconds per pulse, 5 pulses, or 60 seconds plus, with a nice maintenance of that 39, 40 degrees on the surface, which we think translates to about 42 degrees down in that deep dermis where we're trying to get our reaction in the collagen. So we try to get our 5 pulses without having to give up any of that heat. And with the motion, we can just keep doing it. And it's very comfortable. And frankly, you can do this on any part of the body and always improve the skin. So I'll do one more and then you can kind of see. So there you go. If I'm doing this, I would now kind of probably move out here and just do a little bit more to extend this. Go back to your 4 quadrants. You feeling that? Yeah. And it didn't take very much to bring that back up to temperature. She could feel that it was hot. That's a great sign, because what we're knowing is that that energy is still under there, and that's improving that collagen, and that skin tightening is happening, and she's completely comfortable. So we can do one more on each outer quadrant and we'll be all done. And see, with the amount of energy we've laid down, it doesn't take very much to bring that up to temperature. One more. And she's going to do last turn. Okay. And that'll get it even. Don't want to cheat one corner. So there you go. Now if you were going to treat a wider area, you could, if this was for, but that's your skin tightening on the abdomen. So right now we're planning to do a full face and neck treatment on this patient for skin tightening. And if you want to select a candidate, this kind of skin on the neck, which has that very fine kind of folding, we call it crepiness to the skin, is really something that improves dramatically with this procedure. So we like to do this all the way from this part of the back of the neck up onto the lateral part of the cheek, under the orbit, and down to the base of the neck. This whole area will be my left side treatment area. When I treat that area, I will divide it into probably 6 sections. If we turn a little bit more, thanks. This will be kind of section 1, section 2, section 3, section 4, and then up on the face will be 2 areas. Those are not things that we have to stay within the limits of those sections, but it gives you kind of the best size area in order to keep the continuous motion, get good heating quickly, and not go beyond that pain threshold. So this is a very comfortable treatment. So I'm going to go ahead and put some jelly. Now I've already tested this patient's skin temperature before we start. She's starting at about 28, 29 degrees. With our external gun, which is really our only tool at this point that we can use to determine just what kind of energy we are delivering. I'm setting my settings on my skin tight monitor. I do 1 pulse over 11 seconds, and I've been delivering 150 joules in that 11 seconds as 1 pulse. This is kind of what I have found is the maximum energy over time that works comfortably in the areas that I'm using as far as the size of area. It could vary depending on patient.